to healthcare professionals like myself or soon to be, our first and foremost goal is patient care.
As a physical therapist, I'm most passionate in helping people reach their maximum functional ability. So being able to do the things that they want to do in their lives.
It's not just about technology, it's not just about surgeries, it's not just about research. It's about people and how do we do better for people.
I had an opportunity to work with a lot of different experts within the field of medicine. What I learned in that process was that even though it was a collective unit, even within one field, there were some disconnect.
I think interprofessional education has a big role because right now we have teams in healthcare, but they aren't functional teams necessarily. And if the team isn't working, that's when patients' care falls through the cracks and we have these problems, and patients may end up even getting readmitted to the hospital because that care isn't coordinated.
One thing that stands out to me as I've started working more with interprofessional education is that healthcare is so siloed.
You do need multiple players at the table. So you need medicine at the table, you need rehab professionals at the table, you need pharmacy at the table, you need payers at the table to really discuss these challenging issues.
You know, the team approach is where everyone is headed now, just to function as a whole, and it's not just in healthcare.
I worked in a dialysis unit on a clinical rotation of mine. They're actually required to have an interprofessional team to treat them. These patients need to be adherent to a great deal of medications, but they also need to be able to get to dialysis 3 days a week, and if they don't have transportation, they're not gonna get there. So a social worker has a huge role in helping them just get to dialysis. And then nutrition plays a huge role in the patient's care. They're not able to eat whatever they want. Like, that part can go overlooked and they could go downhill very fast. So it was really exciting to see all these healthcare professionals working together to care for such a complex patient.
Interprofessional education has come about because as healthcare has evolved, we've realized that to meet the bio, psycho, social, spiritual needs of clients and patients, that we can't just come from it from one profession. You need to be the most collaborative, best team member you can be.
Working with professionals from other healthcare professions and disciplines has really been eye-opening.
I think the interesting thing about interprofessional education and what's similar to like wanting diversity in medicine in all kind of ways and aspects and facets is that you're learning from people and you're allowing everybody to bring their perspective to the table. And so I think as a doctor, you forget, like, when you send a patient to PT, like, you're not the expert on PT. And so interprofessional education brings all those things together.
When a person has complex health needs, all healthcare professionals should be sharing the weight of that outcome, as well as the patient, because we're relying on him or her to do things as well.
A big part of healthcare that interprofessional education can be influential in is the efficiency of delivery of care and increased patient satisfaction.
Now, the possible health impacts of interprofessional education, I think, are endless. But the bottom line for me would be that it will help those patients who are seeking assistance to gain help from a variety of professionals who can solve various healthcare problems that patients may have.
I think our patients really enjoy seeing their caregivers work together, and that they're hitting kind of every approach that you possibly could to get their best outcome.
I feel that the value of interprofessional education to students, especially as we're starting out our careers, is giving us these real-life skills and communication skills, conflict management, problem-solving skills, so that we can have a chance to practice it before we get out into the working world where we're forced to do that and work with different types of people who come from different backgrounds and different fields.
I think interprofessional education for the University of Michigan student is really important relative to working in teams to solve problems together, to understand the interdisciplinary nature of problem solving, working on cases, looking at problems from different angles, learning from folks who have expertise in other disciplines. I can't imagine why it wouldn't be hugely beneficial to our students here at the University of Michigan.
What excites me about IPE is that we now know that people get better care, safer care, higher quality of care if they have a collaborative team. I think our goals used to be the best social worker you can be the best nurse you can be the best physician you can be. And those are certainly still relevant goals. You know, we often hear on football Fridays the speech, the team, the team, the team. And I think that that has really found its way into healthcare.
What I think the future of healthcare is going to be is that we're going to be moving away from this fee-for-service model, and we're going to have to improve patient outcomes. And in order to do that, we're going to have to work as a team, and we're going to have to provide the highest quality of care, and no one discipline is going to be able to do that alone.
I think we're at a stage in our society where, maybe more so than ever, we need people to enter into the healthcare professions to provide their knowledge and expertise to solve some of the vexing problems that face Americans today, whether it be the obesity issue or diabetes or mental health issues. You know, we need healthcare professionals to address many of these vexing problems.
Wouldn't it be neat if our professional organizations actually work together and lobby to get some of these changes that we know happen to really happen?
I'm hoping that if we connect care, we're gonna give better care. And I think that's everybody's goal. We're supposed to do no harm, but I think more than that, we're supposed to do the most good that we can. And so I hope that interprofessional education pushes us in that direction.